In 2025, a serious public health crisis has emerged in the United States, affecting vulnerable populations. A multi-state Listeria outbreak has been linked to contaminated supplemental shakes consumed by the elderly and immunocompromised. These shakes, meant for health, have caused deaths and illnesses, raising concern among healthcare providers and the public. This outbreak underscores the importance of food safety and the potential severity of foodborne illnesses. The CDC and FDA are investigating the source and ensuring affected products are removed from the market. This situation highlights the devastating impact of foodborne illnesses and the need for strict food safety practices. Ensuring food safety is a shared responsibility, requiring constant vigilance and adherence to protocols. Together, we can prevent such outbreaks and protect public health. The impact of this Listeria outbreak is deeply concerning. As of February 25, 2025, 12 deaths have been attributed to the outbreak. In addition to the fatalities, at least 38 people have fallen ill across 21 states. The affected individuals represent a cross-section of the population, but a common thread connects them. The majority of those who became sick had consumed the contaminated shakes. This outbreak underscores the vulnerability of individuals reliant on supplemental food products. The contaminated products at the heart of this outbreak are Sysco Imperial and Lion's Ready Care supplemental shakes. These shakes are manufactured by Prairie Farms Dairy Inc., a company based in Fort Wayne, Indiana. Unlike many food products sold directly to consumers, these shakes were primarily distributed to hospitals and long-term care facilities. This distribution pattern raises additional concerns. People in hospitals and long-term care facilities are often in fragile health. They may have weakened immune systems, making them more susceptible to severe complications from foodborne illnesses like Listeria infection. Both Prairie Farms Dairy Inc., the manufacturer of the shakes, and Lyons Magnets, the distributor, have taken swift action in response to the outbreak. They have been working tirelessly to ensure that all affected products are removed from the market as quickly as possible. This proactive approach is aimed at protecting consumers and preventing any further incidents. Both companies have issued voluntary recalls of the affected products. This means they are taking responsibility and acting without being forced by regulatory authorities. The recall process involves identifying all batches of the contaminated shakes, notifying retailers and consumers, and ensuring that these products are safely disposed of. Sysco, another distributor of the shakes, has also played a role in mitigating the outbreak. They have been instrumental in coordinating the recall efforts and ensuring that the contaminated products are swiftly removed from their distribution network. Their logistics team has been working around the clock to manage this complex operation. They have recalled the shakes from their customers, halted further purchases of Lyons Magnus products from the implicated Prairie Farms facility, and notified their customers about the recall. Customer service teams have been actively reaching out to consumers to provide information and support during this recall process. The FDA, in an effort to determine the root cause of the contamination, is conducting a thorough on-site investigation at the Prairie Farms facility in Indiana. This investigation involves a detailed examination of the production processes, equipment, and raw materials used in the manufacturing of the shakes. This investigation is crucial for pinpointing where the contamination occurred. By identifying the source, the FDA aims to prevent future outbreaks and ensure that all necessary corrective actions are taken. The findings from this investigation will be critical in improving food safety standards and protecting public health. Listeria monocytogenes is a type of bacteria often found in soil and water. This bacterium is incredibly resilient and can thrive in various environments, making it a significant concern for food safety. It can contaminate various foods, including dairy products, processed meats, and raw fruits and vegetables. These foods can become contaminated at any point during their production, processing, distribution, or preparation. What makes Listeria particularly dangerous is its ability to survive and even multiply at cold temperatures, making refrigeration an ineffective way to eliminate it from contaminated foods. This means that even foods stored in the refrigerator can still pose a risk if they are contaminated with Listeria. Infection with Listeria monocytogenes, known as listeriosis, can be serious, even fatal. The infection can lead to severe health complications, especially in vulnerable populations such as the elderly, newborns, and individuals with weakened immune systems. Symptoms of listeriosis can take up to 70 days to appear after consuming contaminated food. This long incubation period can make it challenging to identify the source of the infection. They can include fever, muscle aches, headache, stiff neck, confusion, loss of balance, and convulsions. These symptoms can vary in severity and may lead to more serious health issues if not treated promptly. Pregnant women are particularly vulnerable to Listeria infection, as it can lead to miscarriage, stillbirth, premature delivery, or serious health problems for the newborn. It is crucial for pregnant women to avoid high-risk foods and practice good food safety habits to protect themselves and their babies. Listeria monocytogenes primarily spreads through contaminated food. When food products are contaminated with Listeria, it can multiply even in refrigerated conditions. Eating contaminated food, even if it has been refrigerated, can lead to infection. While consuming contaminated food is the most common route of transmission, Listeria can also spread from a pregnant woman to her fetus during pregnancy or delivery. Direct contact with contaminated surfaces or soil can also lead to infection, though this is less common. It's important to note that Listeria infection is not contagious from person to person through casual contact. In light of this outbreak, it is crucial for consumers to be vigilant about food safety. First and foremost, avoid consuming any recalled products. If you have any of the recalled shakes in your possession, discard them immediately. Thoroughly clean any surfaces, containers, or refrigerators that may have come into contact with the recalled products. Wash your hands thoroughly with soap and water after handling any potentially contaminated items. If you experience any symptoms of listeriosis, such as fever, muscle aches, headache, or stiff neck, seek medical attention immediately. Listeria infections are treatable with antibiotics. Medical disclaimer. The information provided on this platform is for informational purposes only and is not intended to diagnose, treat, or replace the advice of a healthcare professional. Always consult with a qualified healthcare provider for medical advice, diagnosis, or treatment. Reliance on any information provided here is solely at your own risk. We do not claim to provide medical services or offer specific medical advice. Don't forget to hit that subscribe button, give us a like if you enjoyed the video, and ring the bell to stay updated with all our latest content. Your support means a lot.